Welcome back, sports rehab experts. Today we're going to be going over the top 3 things you can be doing to improve your knee extension after an ACL surgery. And be sure to stay tuned for number 2 and 3 because you probably haven't really thought of these 2 exercises or concepts to improve your knee extension after an ACL surgery. Most people will talk about concept number 1. But before we get into those couple concepts, be sure to like, subscribe, hit that alert button so that you get notified anytime a new video comes your way. We put these videos out on a weekly basis to up your education, help you out as a sports and orthopedic rehab clinician. Now, concept number 1 is one we're probably all familiar with. This is a low load, long duration stretch into knee extension. Now, there's a couple different ways of doing this. If you've treated anybody with an ACL injury before, you've probably seen a myriad of different ways that you can stretch into knee extension. I mean, you as a clinician could kind of force them into knee extension. They could be laying on their stomach, they could be laying on their back. You could have the leg elevated. There's a lot of different ways to do this. Now I'd take this a step further and actually say that the frequency that you do this, especially in the first 2 weeks, matters more than anything. So a lot of clinicians will be super aggressive in the clinic to try to force them into knee extension, and almost sometimes so aggressive that it becomes extremely painful for the individual to bear through some of this knee extension stretching. I don't think it's necessarily to go to that extreme. I think it's more important that the frequency of which you do the knee extension stretch, especially in those first 2 weeks, are super important, because we know if you don't get that knee extension back in the first 2 weeks, it's going to be a struggle down the road. So we really have to emphasize this. This is the most important part of your ACL program in the first 2 weeks. So how do we do this? We need to do it in a comfortable manner, relatively speaking. There's going to be an obvious stretch, tug, pressure development due to the edema, pain post-surgery, and the tightness of the muscle guarding. So it's not going to be the most comfortable thing in the world, and we have to educate the individual that, you know, this is going to be a case and expect some soreness, but we don't want the knee so sore that they don't stretch it multiple times throughout the day, because you need to be doing a knee extension stretch at minimum 4 times a day for about 10 minutes total, so about 40 minutes total throughout the day of trying to stretch your knee into extension. That's first 2 weeks realistically. Now you could do this a little bit more. We could say maybe 5 or 6 times. So between that 4 and 6 range of 10 minutes, so between 40 minutes and 60 minutes a day, you are trying to straighten your knee and return that knee extension back into the knee. And then furthermore with this too, we want to emphasize that the other parts of their day, we don't want to be placing a pillow underneath the knee or anything of that nature that would flex the knee and when they're resting, flex the knee and keep it in a unlocked position. The way I prefer to do this in the clinic is to simply just get the individual comfortable in a seated position, and then have the heel elevated and maybe possibly the calf elevated too, just to provide support at the distal end or the calf, the ankle, and then seated on an object at the proximal end at the hip. So the knee itself is not resting on anything, which allows gravity to kind of do the work for you and allows the knee to be stretched into extension in that manner. And again, held for, you might have to start with 5 minutes at the beginning, but getting up to 10 minutes pretty quickly, and doing that at minimum 4 times a day for the first 2 weeks especially. Eventually you can start adding a little bit of weight, such as an ice pack on top of it, or a very light ankle weight on top of it too. You really don't need to get over 5 pounds with that sort of thing. Again, it's the frequency that matters more than how intense you go for that first 5 to 10 minutes. And if you're going so intense that it can't last for 5 to 10 minutes, then you need to turn back the dial a little bit and be a little bit less aggressive, so you actually get that total time or that total duration into the stretch, because that's what matters most. So that is probably perhaps the most important thing that somebody should be doing. But to help facilitate that a little bit more, there's two concepts that I think are often forgotten about in the rehabilitation that can be started, pretty much immediately post-op, to try to improve, knee extension, but then also, prepare the body for the strengthening that it's going to need. We have other muscles around the knee joint too that we need to be aware of trying to strengthen, not just the quad post-operatively. So number 2 is using a Tibialis Raise. I prefer to do this in seated initially with a band or perhaps a light kettlebell if you have those available to you, or if you have a strap where you can wrap it around your foot. Those all work well, where you can, the weight you would use a light, like say 2 to 5 pound dumbbell initially, but upwards of 10, 15, 25 pound dumbbells later on in the rehabilitation process. I'll get to 25 pound dumbbells strapped onto someone's foot. I'll have them use a band at home if they don't have anything available to them. I'll show you a standing version as well too, and then I also like the kettlebell because the kettlebell provides a little bit more resistance with the great toe, as well as if you have a kettlebell with a big enough handle that fits on somebody's foot, especially with those lighter weighted kettlebells. So these toe raises, first in seated position, resisting the tibialis anterior, which is a dorsiflexor of the foot, but it will also create tibial external rotation, which is super important for the lock home mechanism of knee extension. So we're training that lock home mechanism by training the tibialis. We're also training the muscle that is utilized in the gait cycle at heel strike. So this muscle is super important. We'll start on the table, and then we'll eventually progress someone up into standing. And in standing, now you got gravity helping you extend that knee a little bit more too. Many people also feel their quad with this exercise as well. So these things are super important, super helpful, especially early on, and can be progressively loaded as the individual progresses in their rehab program. And it's something that I'm continually doing with individuals, even when they're 3 to 6 months post-op too, and essentially when they return to sport eventually too. I want them continuing these type of exercises on a maintenance standpoint for just overall joint health and overall resistance to injury. So a tibialis anterior program is super important. Third up is the hamstrings, more specifically the medial hamstrings. Now, initially post-op, you might have to do something simple as like a heel slide in the seated position. That tends to be the most comfortable, least guarded position for someone post-op. And then if you progress that to some resisted seated heel slides, so again, you could just have the foot sliding on the floor. They don't necessarily have to have the foot off the ground or a hamstring flexion machine to train this sort of thing. You can just use a band or have them use a band at home to get the frequency of this activity in a little bit more. Purpose of this is it trains the opposite motion. All too often I see individuals after an ACL surgery, or really any knee surgery for that matter, super guarded. And that just leads to tension and co-contraction around the knee, which doesn't allow for normal joint biomechanics to occur. So getting we mentioned the screw home mechanism into knee extension. Well, getting the knee and the tibia to unlock and internally rotate to allow flexion to occur allows for more fluidity of movement and less muscle guarding altogether. So very commonly early on in the rehabilitation program, you can train hamstring strength in knee flexion in a seated position very comfortably. So you can work that fairly aggressively, which helps with the decreasing in guarding. So that's something simple you can do if you're trying to help with the unlocking mechanism to the screw home mechanism for knee extension. The unlocking concept, we're going to use more of the medial hamstring, and this would be something such as using a bridge, a hamstring emphasized bridge, where I got a video up here showing this. You use 2 legs, but then kind of pushing the knees inward to bias the medial hamstring just a little bit more, or their inner thighs a little bit more. So having them squeeze a foam roller or a ball between the knees is super helpful for that. You can also have them take the knees in and out and just go from medial to lateral hamstring, kind of back and forth. Obviously, both hamstrings are going to be utilized during that entire time, and in those seated hamstring curls, you're going to utilize both hamstrings. but we can bias the medial hamstring to a certain extent, just a little bit more from an EMG standpoint, to again help facilitate some of the biomechanics behind the screw home mechanism and the unlocking mechanism to go into knee flexion, just to help reduce overall guarding of the knee joint in general, to help with more fluidity of movement. Okay, so 3 things that you can be doing very, very early on post-op ACL surgery, and realistically for any type of knee surgery for that matter, is these to improve knee extension, is these frequency, long, low load, long duration stretches, and the frequency that you do it allows you to accumulate a lot more duration into that knee extension. So that's super, super important for developing knee extension, and then training the hamstrings, more specifically the medial hamstring and the tibialis anterior, to help with the screw home mechanism. So keep those ideas in mind next time you have someone with an ACL surgery post-op, or really with anybody who has a knee surgery. These concepts can be super, super useful for you. So hope you found these tips helpful. We'll be back at it next week. Again, be sure to subscribe to this channel and get notified with any alerts coming in the future on YouTube. If you're a rehab clinician, be sure to check out our Sports Rehab Expert Fast Track courses, our Human Assessment Mastery course, and also our Treatment Domination course. Those are the 3 courses that we help clinicians become the sports rehab expert or the orthopedic rehab expert, their go-to expert in your area. If you're someone coming off of a knee surgery and are having difficulty regaining knee extension or knee flexibility, email me at greg@sportsrehabexpert.com, and we'll be talking soon.